I'm Teralis. It's Joseph Teralis Arison. I'm an acupuncturist, is my first license. Yet at this point I do very eclectic bodywork. My mentors for many years now have been osteopaths, where we look at bone and bone-held energy and how to release that and integrate it back into normal function. We all have pain. I think if you look inside right now, there's some place that could use balance. I use a variety of hands-on techniques to restore that balance and often resolve pain that has been lingering for a long time. I use craniosacral work, visionary craniosacral work, on a technique called zero balancing. I also use a technique I call soft tissue reintegration. And that's reintegrating tissue that's either been damaged through traumatic injury or through surgeries. Breast reconstructions, serious bone breaks. There are techniques out there to resolve these pains. I found through many years of practice that the real source of people's pain is often not being addressed. The source of pain may lie years before in what seemed a small injury that was at that point overlooked, and where we go on with the function of our life. Maybe with that little limp in the leg or that little pain in the tailbone where we slipped and fell. And so I look at that history and I incorporate that history into current hands-on methods to allow your body to return to its full function. Scars and traumatic injuries, surgical intervention, all leave with it its myriad of body complaints. These can be addressed and resolved. I work a lot with post-mastectomy, post-chemotherapy, radiation, working to reintegrate a woman's tissue in the breast wall and the side body. I also work quite a bit with yoga teachers and people developing further into their flexibility, or people that have a clear knowledge of their body. So whether you have a clear knowledge of your body or you're looking to gain one, we could work together. As an acupuncturist, I learned many years ago that if I could get a hold of a problem with my hands, I tend to use hands-on techniques. If the pain's here, I probably won't just needle in areas. I'm going to get my hands on that area. Yet, sometimes you can't get your hands on a problem. Someone has a digestive complaint. Then we apply the right acupuncture needles. Sometimes it's the right model, sometimes it's the wrong model, and I've learned to discern which technique should be brought in a situation. When you come to me as a patient, you come in with your own unique puzzle, if you will. And it's our job here to take those pieces apart, learn when the digestive complaints are coming from the structure, from the musculature in the area, or when they have nothing to do with that structure. And so it's to find the formula, the unique formula for you to integrate your whole system. I tend to check over an entire body through part of our session, just to not let something be completely overlooked. You've got a headache, yet the hip pain sort of fell through the cracks. Well, to me, with my background, that headache may come from the fact that your hips are off to one side, your shoulders another, your neck another, and now the head is what hurts. We want to resolve the whole issue. So we want to work on you as a whole and return you to balance. Something overlooked in our busy life is our maintenance of the body. We maintain the products in our life, but we often don't maintain our own body. And so even a 30-minute session once a month can restore a body's vitality with physical, hands-on work. Not deep structural work, but just allowing the joints and the main structures of the body to function normally again. And this little bit on a long-term basis can avoid the serious problems. So whether it's for maintenance or whether it's for resolving a serious or previously unresolved pain issue, I can help you with both.